Good morning. Just type here when you're here.
Hello.
Oh, sorry. Got crazy puppy.
Good morning.
Good morning. Hope everyone's doing well. Okay. Hello. Ah. Um. Okay. We're getting there. Hang on, everyone just type here. I gotta check one thing. I'll be right back. Watch him close because he flies in like a second. Just if he starts wandering away, I'm not playing. Oh, Gabe? Gabe! You know to give Claire, crack one of those things, give her one in her room, and give Tiger one. Yeah. Okay, sorry. What I ended with was the control of urination and just something to think about anytime we have an animal with a ruptured disc, like the long-backed dogs, the dachshunds, the bassets are more prone to that. If we have a dog with degenerative myelopathy, which is where the spinal cord starts to degenerate, if we have a dog with a trauma and a back fracture, one of the first things that we check in these dogs, or we try to make sure, is can they urinate on their own? Now, I've had old dogs that have, their back is getting old. It's maybe not a defined disease. Sometimes there's dribbling of urine. There's a condition called urinary incontinence where it tends to be older females that have been spayed, where sometimes they'll wake up and there's like a puddle of urine. That has to do a little more with the sphincter control, and there's a theory it's related to hormones, older age. We put them on medication to strengthen the sphincter, called Proin. But that, if there's dribbling of urine and lack of control, and it's a female and she's middle-aged, we tend to think of the urinary incontinence. And then if we have any kind of neurologic trauma, vertebral disc disease, we usually, in them, the issue is they cannot urinate, and we would have to manually squeeze their bladder or put in a urinary catheter, which we do. The problem is we don't like to send home urinary catheters because accidents can happen. They're a big source of infection, so have to be careful there. As far as anatomy, we got to talk about the last part of the urinary tract, because we've talked about the kidneys, we've got the ureters, we've got the bladder, and then we've got the urethra. And it's a continuation from the bladder to outside of the body, either the vulva or the penis. And it actually goes through the pelvic canal. What is not in this picture is that the pelvis is going to be right about here. So in the male, okay, the urethra comes up over the pelvis and comes under, and I'm kind of tracing it on the picture if you don't see the picture here. And in the female, it comes up over the pelvis here. The reason I bring that up, like usually when we do dissection, which I still have to figure out if we can do that, but we have the animal in BD, and you can find the bladder, and I have everybody find the urethra, and then underneath, because they're like, well, I want to see it go where it goes, but it's under the pelvis. I'm like, we'd have to crack the pelvis and split the pelvis open to show where it goes. So, and that's the other reason, if animals were to get a stone or something stuck there in that location, it's a very difficult location to operate on because we would have to crack the pelvis to access it, which most surgeons are not willing to do. So you talk about surgery options later, but I want you to understand there is a big difference, and you have to be able to tell me the difference from a male urethra and a female urethra. Now, this is in the dog. So in the female urethra, it's very short and straight. It kind of leaves the bladder, and then it goes straight out to the vulva, up over the pelvis and out to the vulva. It opens into the vulva. So when you see the vulva on the outside, there is an opening there, and it does have transitional epithelium. So the same lining of the bladder lines the urethra, and it's because it can stretch. If they have to urinate a large volume versus a small volume, it can accommodate larger volumes. Now, the male urethra is longer and curved. So the first difference is the length, kind of the description, long and curved versus short and straight. It runs along the ventral aspect of the penis. But a key difference in the female, the urethra only has urinary function. The urethra only carries urine. In the male, it has urinary and reproductive. Okay, let me go back to the picture. So in a male, and we're going to do reproductive in 2 weeks. We're going to do endocrine next, and then we do reproduction. So I go into this a little bit again, but the testicles would be out here. There's a tube called the vas deferens that takes the sperm up over the bladder, and it connects to the neck of the bladder. So during breeding, Ireland, it's not one of my favorite sections. Endocrine's a little bit difficult. In school, for me as a student, I was like, endocrine, what? I try to make it easy. I try to make it self-explanatory. But so what happens here is sperm is the vas deferens is going to connect to the neck of the bladder. Now, if you have an intact male during breeding, when they actually ejaculate, the neck of the bladder is going to close off. So when they ejaculate, it should only be semen, but it goes in the same tube as the urine. They shouldn't expel them at the same time. But I will tell you, and potentially at school, or if you have a male dog and he is intact, he's not neutered, and you do a urinalysis, you may find an occasional sperm on the urinalysis sample because it is the same tubing, so to speak, okay? If they're neutered, you should not find that. But there are a lot, there's dogs that, don't get neutered, and they may come in for urinary issues. So though that's the two ways I would describe it is, the female is short and straight and only has reproductive function. The male is long and curved, and it has reproductive and urinary function. Now, a male cat is a little different. A male cat doesn't have, a male dog, the penis is on the belly or on the abdomen. In a male cat, it's similar to the female dog because it comes straight out. So on a male cat, if you lift the tail, you'll see the rectum, and then you'll see a little round extra spot where you can, and the penis is very retracted. Also, they have a barbed penis. Male cats have these barbs. It's part of their reproduction because cats are induced ovulators, and part of the barbs on the penis help induce the female cat into ovulation, and we get into that. So a male cat, now the only similarity in a male cat and a female dog is the location of the urethra. The male cat urethra still has urinary and reproductive function. Okay. So that's how I would want you to explain it. Do you have any questions on that? Okay. So let's just go ahead. If you have your urinary homework, or if you want to just take notes on a separate piece of paper, but I will go over some of these answers, and this kind of will be our review. So basically, for identify the structures of the urinary system, it was pretty much bladder, ureter, urethra, and kidneys. So structure-wise, does anybody remember which kidney is first? I guess no, that wasn't the right way to say that. Cranial. The right kidney is a little more cranial than the left, but 2 kidneys, 2 ureters, a bladder, and a urethra. So parts-wise, pretty simple. Major route for removal of wastes and excess water. So water balance in the body, kidney plays a huge role in that. So functions of the kidney basically are slide number 6. So for number 2, slide number 6 pretty much gives you your answer. So you've got waste, waste is the number one thing. You got to get rid of the wastes. And then it maintains homeostasis. Now, on a test, I would not want you to put it maintains homeostasis. That's way too broad. I mean, how does it maintain homeostasis? And then you have all those answers. So maintaining homeostasis, you have to explain what it does. Fluid balance, blood filtration, reabsorption, and secretion. Because remember, when the kidneys filter, they push out good and bad. So you have to, the body has to have a way to reclaim what accidentally gets pushed out. Acid base, ADH, it produces hormones and regulates blood pressure, which is huge. So that's any of those. Now for number 3, this would be slide number 7. For number 3, your answer is in slide number 7. Now if I say, where are the kidneys located? If someone tells me they're in the abdomen, that's wrong. Well, you're partly right. I mean, it is in the abdomen, but I need you to describe dorsal abdominal area, ventral to the first few lumbar vertebrae. So they are caudal. I've also had people say they're caudal to T13, which is true. Now, let me explain something though. Anything in the abdomen, the whole abdomen is caudal to T13. That's like me telling you the gas station is behind the school. I mean, you might want to give a few more directions. It's like, oh, it's behind here. It's caudal to the last rib, but it's ventral to the first few lumbar vertebrae, and it's retroperitoneal, which means it's up under the lining of the peritoneum. They're kind of anchored up in the back. They're up against the vertebrae. So for number 3, I want you to be more, for slide number 7, be specific where they are. For number 4, identify the cortex, medulla, calyx, and hilus, which that is, all of those are the gross anatomy. Okay, the hilus, all the hilus is talking about is this indentation. That's where the blood and the nerve supply and the ureter enter the kidney. So it's kind of like where everything comes together in one location. And it does have a capsule, but the cortex is the outside, like the C for cortex. The medulla is here in the middle. And remember, this is where the nephrons are. The nephrons are all embedded in the cortex and medulla. And let me see, I had a paper. A medium-sized cat, just for an example, has about 200,000 nephrons. A medium-sized dog has about 700,000 nephrons per kidney. So that gives you an idea. All embedded here microscopically is where all those nephrons are. Now the calyces versus the pelvis. The calyce is like a little tube, and it's going to be helping funnel the urine from the cortex and medulla to the pelvis. So it's like a connection between the two. That's what the calyces are. Okay. What is the nephron? Oh, and remember on this picture, remember the one species. Does anybody remember what kidney this is up here of what animal? The top kidney? It's the cow. So the cow has this kind of, that's very normal. If that was a dog, that would be no bueno. But that's a cow. They're lobular, so same function, same basic structures, just a little bit different arrangement. Now, these are the parts in the nephron. This is the slide you need to know, number 11 slide. This goes over what's going to be the image to label on the test. So number 6 pertains to slide number 11, where it says list the function of each. The image of the nephron is slide 11. But if you get into what's the job of each, it's the slides after slide 11. So the corpuscle, it basically filters the blood, and that is the first stage of urine production. The very first part urine is beginning to be made is in this structure. And this thing right here in the middle is the glomerulus. Remember, this is the strainer. This is my strainer analogy, okay? If you pour canned tomatoes in here, what's going to come out from the strainer is going to become glomerular filtrate. That's what came out. Obviously, not everything fits through a strainer. And so what remains in the glomerulus is going to go back into the efferent arteriole. So the afferent arteriole is the blood supply coming in, the efferent arteriole is the blood leaving. Now, this efferent arteriole contains oxygenated blood, and this is going to become the peritubular capillaries. When it leaves the glomerulus and then it forms those capillaries that surround all the yellow tubes, follow the branch. Renal artery is over here. Renal arteriole, afferent arteriole filters, efferent arteriole leaves, peritubular capillaries oxygenate the nephron. So the glomerulus, so we talked about the corpuscle. I guess I should say the corpuscle isn't the filter, okay? The corpuscle, if you look at this picture, the corpuscle contains the Bowman's capsule and the glomerulus. So the function of that is just to hold that all together, to have a space where the filtrate can be held. The glomerulus is the filter. So I'm thinking back, I used to get that question on this homework from students, because The one of a function is just to hold, the second is the filter. The PCT, which is the proximal convoluted tubule, is basically you have reabsorption and secretion functions. Okay. Remember, reabsorption is getting reabsorbed where? Where, if I say reabsorption is occurring, where is something getting reabsorbed? Into the blood, which is the peritubular capillaries. So the peritubular capillaries are the site of reabsorption. If it's going to be secreted, it's going to stay in the PCT, the loop, and the DCT, and it's eventually going to go to the collecting duct. The collecting duct is the primary place where, if it stays in those tubes, it will get secreted as urine. So if the body wants to reclaim something, it has to reclaim it into the blood because it got pushed out. It'll reclaim it in the blood and it can go back into circulation. The DCT is an extension of the loop of Henle, and it basically takes, all of them are going to empty in the collecting ducts, and this is the primary site of ADH action, acid-base balance. But remember what a little hint I told you about the DCT. It's the last stop. Right after the DCT is the collecting duct. And once it's in the collecting duct, the body's not going to reclaim it. So the body's kind of like got a little bit of time to go, do we want to keep it in the PCT, loop of Henle? By the time it gets to the DCT, it's like, we better do something now or it's going to be gone. And then the loop is basically a continuation of the PCT, and there is some reabsorption here. So there is some reabsorption at this point. So for number 7, what is the primary blood supply to the kidney? What is the afferent and efferent? What are the capillaries? So I think I kind of, remember, I don't know, I don't think I have a question about this, but remember, the kidney is under parasympathetic control. So we don't have conscious control. Think about it. Urine is constantly being produced. But if the animal is in sympathetic stimulation during fight and flight, any blood supply to smooth muscles or some of these organs, remember, it gets vasoconstricted. So not as much urine or not as much blood is being sent to the kidney during sympathetic stimulation. Therefore, not as much blood is being filtered. Therefore, urine production is decreased. Once we're in rest and restore, which is parasympathetic, that blood supply is going to go back to the kidney, and then urine production is going to pick up again. So the blood supply, you're going to have the renal artery branches off the aorta. It's going to branch into a renal arteriole, but in the kidney, they call them afferent and efferent. So an afferent glomerular artery, if you look here, here's an artery, here's afferent, comes in the glomerulus, and then it gets filtered, pushes out some plasma, and then basically the efferent arteriole leaves, and that is what becomes peritubular capillaries. And remember, if I said, what is the oxygen transfer site in the kidney, you would tell me the peritubular capillaries. An artery and arteriole does not exchange oxygen. It has to happen at the capillary level. It cannot happen before that. So once it gets to the capillaries, it can give oxygen, pick up CO2, but it comes in first as an afferent arteriole and leaves as an efferent arteriole. Number 8, where is okay, PowerPoint's being grumpy. Oh, hang on. The computer said it's a full moon and it's Monday too. Hmm. Okay, so if we go back, basically, this is simple for number 8. Urine is made in the kidneys and it's stored and excreted from the bladder. As long as I've occasionally had someone tell me the bladder makes urine, the bladder just stores it. The kidneys produce it and it is excreted at different times, you know, via that mechanism that we talked about. It says number 9, explain the GFR, primary absorption, primary secretion. So basically, for number 9, slide 21, 22, 23, 24, these slides right here kind of explain number 9. GFR stands for, you need to know, glomerular filtration rate, the rate of production of filtrate. So when the arterial blood, remember, arterial blood that branched to the renal artery is going to divide to every nephron, all of those afferent arterioles. It depends on the rate of blood flow to the kidney. Obviously, if I had an animal with really low blood pressure, say an animal was in shock or came in trauma, and there wasn't as much blood flow to the kidney, what's that going to do to my GFR? How does low blood pressure or lack of blood flow to the kidney affect the GFR, which is the glomerular filtration rate? It would go down. If you do not have as much blood or you do not have as much pressure, your GFR or rate of filtrate production is going to decrease. Therefore, if you have high blood pressure and you increase the pressure in the arteries, it's going to increase the pressure into that little filter, the glomerulus, and by nature, you're going to increase. Now, the capillaries in the Bowman's capsule, the glomerulus, that's basically a bunch of little capillaries in a ball, kind of. They have little fenestrations. Capillaries have little holes. Now, when you, in a normal animal, everyday normal activity, there should not be protein that gets pushed out into the filtrate. And that's very important. When you guys do urine and you talk about animals in practice, if we have positive protein on a urine, and there's levels of high protein, I want to say on a dipstick it goes like trace, 1+, 2+, 3+. Trace protein can sometimes happen, but if what we're thinking about is protein is a large molecule. When it shouldn't fit through the strainer. But remember what I told you, if you poured the tomatoes in the can and then you pushed on the tomatoes, okay, eventually little bits of the tomatoes you might force through the strainer because you're putting the tomatoes under pressure. So sometimes in high blood pressure, things get forced out into the filtrate that really aren't supposed to. But because it's under higher pressure, it does. So again, there's many reasons for proteinuria. One thing we look at is high blood pressure. You'd obviously look at protein in the diet. If you've got somebody feeding their dog like a whole chicken and 6-8 eggs a day, in addition to their dog food, that's a lot of protein. Sometimes people are adding a lot to try and add more protein to their diet. So we'd have to look at diet. We'd have to look at history. We'd have to get blood pressure. We'd, figure out what is the reason. Also, dogs with a UTI. If they have cells in their urine, red blood cells, white blood cells, but remember I told you, red blood cells, white blood cells in urine is probably because the infection is in the bladder and there's a little bit of blood and the white cells are fighting an infection. So those aren't coming from the filtrate. That's coming from irritation in the bladder. But cells in urine will cause a positive protein. So if I see 1 plus 2 plus protein and I have red blood cells and white cells, most of the time we're going to assume the protein is because of the infection. If I have protein and no red blood cells and no white blood cells and no other signs of infection, then I have to figure out why the animal is losing protein in the urine. Or, the doctor has to figure out. Primary absorption. So back on number 9, I've explained GFR. Reabsorption is going to happen at the peritubular capillaries. If I asked you, what are things the kidney wants or the blood wants to reabsorb, these are the good things. But remember, I said they just get pushed out. Sodium, potassium, calcium, glucose. Bicarb is a buffer. And water. Reabsorption needs some help. Sodium needs some help. So that moves via sodium co-transport. Now, secretion primarily happens at the DCT because this is the last thing, but things that are going to be secreted, hydrogen, potassium, ammonia is a big one. And medications are secreted. Now, when you have pharmacology, there's 2 ways medications are secreted, active or inactive. Most of the time, the liver biotransforms or breaks down medications, and what's being secreted is inactive drug. It means it's kind of taking it apart. But there are some drugs, specifically the anesthetic ketamine, especially in the cat, 90% of ketamine is excreted active in the kidney. So the way a cat gets rid of ketamine, it has to be secreted into the urine. If they can't urinate, if they have renal impairment, then it's going to impair secretion. Therefore, it stays in the blood and the cat stays asleep. So we're really cautious with that. Urine regulation, which is on slide 27 for number 10. The urine volume is determined by how much water makes it to the tubular filtrate, is basically. Now, that is under influence. Mainly what I want to talk about is ADH. ADH is antidiuretic hormone. If the animal is dehydrated, if the animal is not drinking as much, not as much water is going to make it into the urine, because what's going to happen is the brain is going to release ADH. ADH is going to tell the kidney to retain or reabsorb body water. Therefore, the urine is going to be more concentrated. If an animal is deficient or does not have enough ADH, then the problem is water is just going to keep getting sent to the kidney, and they can't control how much water leaves, and therefore you get polyuria. Remember, I explained polyuria is increased urination, and then it does something else. It makes them polydipsic. But what's driving the drinking is the increase in urination. Because like I said, PUPD, if an animal comes in PUPD, I'm not like, oh my gosh, you're ADH deficient. There's a lot of diseases where PUPD happens. So again, we have to do a little more digging, but this could be one of the things. If fluid is retained and not excreted as urine, how does that affect blood pressure? It increases blood pressure. So the way the kidneys try to adjust blood pressure, the renin-angiotensin system, basically what happens is when renin is released, it's going to increase sodium and water being reabsorbed into the blood. Basically, I hope you've learned this in chemistry. Water follows sodium. If sodium's like, I'm going back to the blood, water's like, oh, I'm coming with you. If sodium goes with way, water's like, I'm going with you. They move together a lot of the time. So a lot of times the sodium potassium balance affects water balance. In this situation, sodium got pushed out in the filtrate. The kidney says, no, I got increased blood pressure. Sodium moves back into the blood. Water that was in the filtrate gets put back in the blood, and then you have tubes. You've just increased pressure. If water and sodium is not excreted, if the body retains fluid in the bloodstream, it's going to increase the pressure in that vessel. For number 12, basically this is slide 29. The ureters originate at the kidneys, but they enter the bladder at the trigone. The trigone is at the dorsal aspect of the neck of the bladder. So the trigone, this area in layman's terms, is the neck, because if this is the head and the neck, but there's two little openings and they enter at the trigone. Control of urination, and they come at an angle. Now remember, urine should go kidneys, ureter, bladder, urethra. It should never backflow, because when the bladder gets full to capacity, it basically should close off the opening to the ureter. The animal urinates, the bladder empties, the ureters open back up, and the bladder refills. This is happening continuously. Doesn't stop. This is a continuous process. What causes the contraction is basically this: when the bladder gets full. Now, this is just explaining. There's transitional epithelium is the lining. The detrusor muscle is the muscle of the bladder, and the sphincter controls the flow. But what happens is basically it accumulates, and then stretch receptors monitor how big it is. When it gets too big, it's going to send a signal because it's at a pressure point, and basically the spinal reflex activates, and then a signal can go to the detrusor muscle. So that's the whole process. Slide 35 and 36 kind of answer 13. And then the 3 steps to urination: accumulation, muscle contraction, the sphincter has to relax. That's where the potty training comes into place. So hopefully they have enough control of their sphincter where they can hold it. But I mean, this is why you don't leave your dog for, hours and hours and hours on end, is because, that sphincter can hold, but eventually the bladder is going to be like, I gotta go. And let's see. Okay. And then the difference between the two, I don't blame it. What kind of dog was it, Ireland? That's heat stroke. Oh, I was going to guess a brachycephalic. I was going to throw it out there because those dogs, yikey. He was a big one. I feel like every brachycephalic should come with a warning card that says, do not play with me if it's above 75 or 80 degrees. Unless I'm in shade. I mean, they overheat so quick. Or they could have had him outside in the yard. Oh God. Oh. See, I was going to say, sometimes it's not even playing with them. It's just being out in that beating sun. I mean, I had the puppy outside. My, puppy's black, and he's not, he's not super smushed, but boxers, I'm still more cautious with Bo because I know boxers to some degree are a little brachycephalic, but he doesn't have a high heat tolerance. You know, they were outside with my mom the one weekend and I kept wetting them down because she'd been sitting outside and I'm like, Mom, we got to bring them in. And they weren't even playing. They were just like sitting on the deck. Oh, I hope they have like $1 million, these people. Two Frenchies and a bulldog. I hope they have a good doggy bank account. Oh, they pulled up in Lincoln. Yeah. Oh, that's so sad. That's so sad. Yes, be cautious of your brachycephalics. When I had people, and this is a little side note when you guys are in practice, because you guys deal with the clients a good amount and people ask you questions. But if people came in with a bulldog puppy, a Boston puppy, a Frenchie puppies, cats could, if you had like a Pekingese, the real short nose and they go outside, they don't often, because cats have a good way of like, I'm going to go lay in the shade, and cats don't do much activity. But if you did have an outdoor cat, I have to say I've not really seen a cat with heat stroke, but based on anatomy, the possibility's there. But when I would have clients, when I was in general practice, before I was in specialty practice, I would, the puppy visit, I'm like, do you know about heat stroke and you know about brachycephalic or short nose, syndromes? And some owners would be like, yes, I've researched it, but um, yeah. And I mean, and sometimes they are so like, people have no idea what they've gotten themselves into with these dogs. So I am very upfront to say, and if some people say, yes, I've researched it, but I always try to give them that information when they come in very young to say, these are things you shouldn't do with them. And hopefully they obey the rules. That's very sad. Yeah, the highest I've seen a dog survive, I had a Chihuahua seizing for an hour. Um, well, not mine, came to practice, and it was 107.9. It actually survived. The doctor was shocked. I was shocked. But normally when you get up, higher of 106, getting to 107, brain fry is going to start to kick in. And that's what we worry about. Also, um, issues with the blood. So keep them cool, keep them cool. People, it's really hot outside. So that when I say, let me give you an example of a question. When I say for number 15, what are two differences? I sometimes have people say the male is long and curved, the female is short and straight. That's one example because you're explaining that difference between the two. Do you see what I'm saying? The second thing is function. So one difference is shape, long and curved, short and straight. The second difference is function. The male has reproductive and urinary function. The female only has urine production. If I didn't stress this on the picture, in the female, not in this picture, is the ovaries and the uterus and the vagina. A lot of people look on the outside of a dog and say, there's her vagina. That's the vulva. Inside, deeper, is the vagina. But when they come together here, there is one common opening, but the reproductive tract is separate from the urinary tract. Okay, that's the difference in the female. Even though they come together here, the primary reproductive tract is all separate in the female. In the male, the semen is going to exit the same tube that urine does. And again, that's typically not a problem. When we get into reproduction, if we have an animal that's not getting the female pregnant, if we have a male and there's no pregnancies occurring, we do semen analysis. And one thing we check when we analyze semen is the pH and color. There is a chance that if something was defective, that urine could mix with semen and that could kill sperm. But that would be an abnormality. Normally, urinary function should close off during reproductive function or during breeding. But again, one of the things in semen analysis is if if urine is mixing with semen, it's going to change the pH, it's going to change the color, and that's what we're going to look at. Okay, let me mention one more thing. Let me see. I mentioned this. There's something called ectopic ureters, and some of you may have heard of this. It is a genetic abnormality. If a dog is born, and it can happen in a male or a female, if for some reason the ureters, when ectopic means they are somewhere they're not supposed to be, okay? If something's occurring in an abnormal location. If a ureter, do you see how it enters the bladder? And then you have the sphincter. Okay, here's your ureters, here's the bladder, the sphincter is right here. Sometimes these ureters are connected to the urethra, past the sphincter. What happens is somebody adopts a pup or somebody gets a puppy, okay? And all of a sudden the dog is like walking and peeing or walking in the house and peeing. The problem is kidneys are making urine. Urine is being deposited after the sphincter. So there's no control. So as urine is being made, it's going right to the urethra and it's coming out whenever it wants to. So this constant, and sometimes when people get puppies, they're like, oh, he's dribbling. Oh, he had an accident. Now, when AJ has an accident, he walks in the kitchen and he squats. It's not like he's walking and urine is coming out as he's walking. And again, ectopic ureters are a puppy disorder. Most of the time people are going to discover this, again, a lot of people blow it off in the first 2, 3, 4 weeks of having a puppy going, oh, they're just dribbling because they can't hold their pee. That's not normal. Okay, they shouldn't be dribbling as they walk. The difference with urinary incontinence, if I'm an old dog and my sphincter is weakened, then I dribble or I have urine when I wake up. But if I'm a puppy and I'm doing that, it could be an ectopic ureter. And it could be one or it could be both. So you could have one ureter that's normal and one that is here. And that's, you can surgically fix that. You basically have to detach and reattach it in the new location. So if you hear about that, I just, wanted to explain what that is. Are there any questions about the homework or anything that we talked about? Okay. I'm going to tell you my computer. Actually, yeah, I can probably say it. Jonathan withdrew. I don't know why. I just got an email from administration that he voluntarily withdrew. Yeah, I don't know why. I mean, he had missed a few lectures for us, and I thought it was odd because he's usually here all the time. I hope he's okay, and maybe he keeps in touch with you guys. I was probably going to email him, and just say good luck and, oh, that's too bad. Was he frustrated because of online? Because, I mean, online is hopefully we don't want to keep doing this,
I think it was a combination of the online